Welcome back, everybody. This is John Malanka with the United Patients Group. Be informed and be well. Today's special guest is Dr. Nigam Arora. He's an expert in interdisciplinary life science research with present focus on medical cannabis and cannabis in whole. He received his PhD from Purdue University, where his research sat at the nexus of organic chemistry, medical device manufacturing, as well as nanotechnology. Dr. Arora's long-standing interest in translational research and entrepreneurship led him to enter the cannabis industry, where he has held positions as the chief scientific officer of a cannabis data company based out of Massachusetts, as well as the chief of staff and head of licensing for a multi-license holder here in California. Additionally, Dr. Arora serves as a co-organizer for cannabis-focused symposia at the American Chemical Society, the ACS, and at their national meetings. These symposiums are organized by the Cannabis Chemistry, which is CANN, which is a subdivision of ACS, of which Dr. Arora serves as a publication committee chair. Dr. Arora also spent 1 year serving on the policy committee of the Humboldt County Growers Alliance, which is the largest cannabis industry advocacy organization in California, and probably the oldest too. We'll get into that. In his current position, Dr. Arora serves as the Chief Strategy Officer at Via Innovations, a leading cannabis formulation company with a strong track record of bringing innovation to the space of medical cannabis. So, Nigam, I'll greet you by Nigam. That's how I know you, Dr. Arora as well. But welcome to the show. Thanks for being on. How are you doing today?
Yeah, so happy to be here. Thanks for the invite. Doing great. Happy to get into some of these topics with you today.
Yeah, so first off, translational research. I know translational medicine. Can you break that up? I know it's you're a scientist, your background.
Sure.
You want to talk a little bit more about that?
Absolutely. So translational research is something I'm particularly interested in. So what that means is it is the process of translating something that we do in the lab on the bench to something that we can take to the market, to the consumer. So often what we find in research, especially fundamental research, is that scientists and academics are chasing a theoretical knowledge, and for the purpose of publication and for advancing their field on a theoretical front. So that's great for advancing research itself, but some of these things never make it to market. Now, the translational process is important because it helps us make sure that some of these most important advancements do make it to market. And there's actually, for example, at Purdue, they have a pretty big emphasis on this, and they have kind of programs for myself as a student. There were classes and programs I could participate in as a PhD student to learn and understand that process. And I actually, coming from an entrepreneurial background, had a big focus on that. So even when I entered a PhD, I was passionate about chemistry and about interdisciplinary science, but I wanted to learn not just about the science, but about how do we take the science and the scientific advancements to the consumer rapidly. So that's what we mean by translational.
And so, well, let's go with the consumer, because what we do here at United Patients Group and bringing experts like you on is information education, helping patients, their families, their doctors avoid the tangled web in this industry, and, having a deadline like we did with my father-in-law. You and I have spoken offline. He was given 2 weeks to live. And we were very fortunate. It was the blind leading the blind back then. It was trial and error. Thank goodness we didn't have any error. We had success. And so, but nowadays, this industry is just booming with all these different products, what to trust, what to listen to, what to use. And so with scientists like you and bringing new products to market, how does a consumer choose the best cannabis products, for their needs? When I said we jumped in this industry back in 2010, 2011, THC was the buzzword, of course. And we were very fortunate in battling cancer with my father-in-law. He had a 4-to-1 ratio of THC to CBD. And so does THC matter? And is CBD, because everywhere you're looking now, it's kind of taken over the market. And so what are your thoughts of that?
Totally. So yeah, I'll address a few of those questions. So first thing is yes, THC does absolutely matter. But so I want to go back to your first question about how does a consumer some of the baseline things to choose a good product for them, and then let's come back and then we'll incorporate in that a little bit of the components that they should be looking for, and as you mentioned, ratios and stuff like that. So there's a few baseline things a consumer should be looking for. The first one is for safety and confidence
Yeah.
in their brand. So be that a brand that contains, or I should say a brand or a product that contains THC, that is either sold in the regulated market, in their state regulated market, or maybe that is homegrown where home grow is allowed, which it is in several states, and I'm a big supporter of that. I think it makes sense for people to be able to create their own medicine affordably at home. But wherever the source is, safety. So the brand or the store where you're buying it, do they have certificates of analysis showing that these products have been tested by a certified lab as safe? And on top of that, you can kind of check the track record. You can talk to folks um, at the store. You can talk to people in your network, maybe your doctor who you worked with to learn about medical cannabis, or even you got to be careful what resources you use, but there are online resources where people are posting reviews and experiences and stuff like that. So you don't want to rely too heavily on any one of these things, but it's just like anything in life, having multiple places, multiple tools, you can begin to understand kind of holistically what is going on with these products. So the other thing I would say in a similar vein is for people who are utilizing cannabis from home grow, that it's equally important to make sure that it's being done safely, because there are concerns with use of fertilizers, pesticides, things like this. So a lot of labs will, or at least when I was in Massachusetts working there, for example, I know there were labs there that would test home grow cannabis, and you can do the same thing. You can get it tested to make sure it's safe. So, and then the other thing is just to build experience with people who have learned how to use organic growing practices and stuff like that. So those are some avenues to ensure safety. Now, going to specific products and discussion of THC and of other cannabinoids. So this is really a very personal and condition specific topic.
Uh-huh.
But what I can say broadly is that for each person, there's going to be, for each person and for a certain condition or need, there's going to be specific products that, or excuse me, specific cannabinoids or ratios of cannabinoids that are going to be best for them. So, for example, as you mentioned, for your father-in-law, he was using a 4-to-1 CBD to THC ratio.
Actually, the other way around,
Oh, I'm
THC.
sorry. I'm sorry. The
Yeah.
other way.
Yeah.
Okay,
And
understood.
back in those days, when you would say 4-to-1, the four used to be the
THC.
THC. And so that's why I would
Understood.
share. You will always know, because there are still some companies out there that you will use that same ratio, 4-to-1. So for our listeners, 4 parts, it'll say 4-to-1 ratio, 4 parts THC to 1 CBD, or nowadays most companies will say 4 parts CBD to 1 part THC. So please make sure you know, because that could be an ugly mistake, which we've seen quite a few people. It's an uncomfortable mistake, I should say, not an ugly mistake. So didn't
Totally. So
didn't mean to cut you there.
no worries at all. That's an excellent clarification and an interesting historical perspective as well.
Yeah.
But anyway, so for example, each individual is different. So depending on the condition, depending on tolerance, and also things like need for function. For example, if someone is recovering and they're able to take time off and they're not needing to work or drive a vehicle or do stuff like that, there may be different options for them versus maybe someone who needs to use cannabis as medicine to mitigate pain or to mitigate other symptoms or to regulate certain body functions and continue to work or do different functions. So CBD is great. It has a lot of benefits, especially in combination with other cannabinoids such as THC. And there's other cannabinoids of interest too, especially here in California. We have pretty great access to things like CBG, Delta 8 THC, CBN, um, THCA, CBDA, some of these kind of more novel cannabinoids. So we can get into more later what some of those are supposedly good for, but yeah, so there's a lot to explore for the consumer, though.
You know, you being an advocate for consumers as well, and with what you're doing, well, let's back up a little bit. You know, you're talking about safety. You know, use with confidence, grow with confidence. If you're doing a home grow, what do you say for the families and or the growers or the patients that don't live in legal states? Yes, they can grow, but they don't have access to really go test it to see. Okay, are there pesticides in here? Is there mold in my medicine?
Mhm.
Is there any, easy way? I mean, I always share with people, it's a beautiful plant to grow. Don't get caught. So I'm not advising anybody to break the law. But I also say, before you uproot yourself and you become a cannabis refugee, fly out to a legal state, 2 days, 2 weeks, 2 months, whichever you're able to do, and see if this medicine works for you, this plant works for you. Because the last thing, and I'm certain you agree with me, is that this isn't the golden pill, the golden ticket. It's not, here, take this and you're healed. So do you ever share that with I guess consumers that you're working with?
Yeah, so great topic and a few feedbacks there. So one, I agree with you. This is not a panacea, and not only is it not a panacea, but high quality cannabis flower contains hundreds of useful molecules. So as we were discussing, we we're saying THC, that's one molecule out of hundreds. We were saying CBD, that's one molecule out of hundreds. So that's important. But to answer your direct question, a few things that I would recommend. I do support what you're saying, that folks who don't have legal options in their locality, I think that's great to travel somewhere where you can assess it in a legal and safe way and begin to understand it. I think that's great. The other thing I would say, for people doing home grow without access to testing, there are pretty well known organic growing practices, pesticide free practices that you can utilize to kind of as a baseline avoid some of these things. So you're never putting harsh chemicals as nutrients in your soil. You're never putting harsh pesticides on your plants that may kind of stay there as residuals later. So, and then the last thing that I would advise is advocacy. So there's a long history, and we can go back. That's a whole topic for another show maybe, but there's a long history of advocacy, and the way that we have legal cannabis in a lot of these states is that folks there cared about it, and they weren't afraid to stand up and say that it should be legal, if nothing else, for medical purposes. So that's another thing. I know it can be hard, but for some people, depending on their jurisdiction, to make your voice heard and that kind of thing. But I think that in the year 2020, cannabis in so many states is a essential business, and COVID and all these things. I think advocacy is as important as ever, especially for those folks who don't have safe and regulated access yet in their local jurisdiction.
Yeah, and I think the stigma is dropping. As you and I talked, Corinne and I started United Patient Group back in 2010, 2011, and the stigma was there big time. And we talked about this because remember I didn't use Malanka in our press releases, and people got upset. And I asked you the same thing. How did you tell your parents? Because your sister is a Harvard doctor, isn't she as well?
Yeah, she's a PhD doctor.
PhD doctor, and I said, boy, how did you share this with your parents? Mom, Dad, I'm going to get into the cannabis industry. So, but the stigma has changed a lot. And I remember when you shared this with your parents, you said you sat them down and you had a full-on talk. You said, Mom, Dad, let me just talk. And the entrepreneur and your dad, in seeing what was going on, and I love that story, was like, son, you have my backing. Let's go for it. So having that parental support is really, really nice. but bringing that stigma down. Like you said, right now we're in 33 states, including District of Columbia. After this 2020 election, of course, that number is going to go up. So people are realizing there's another way in battling other ailments with the help of cannabis. Bringing your opioid use down, maybe avoiding chemo radiation. If you have something as serious as cancer. You talked about the hundreds of cannabinoids in your cannabinoid book. What is your number? Because I've heard everything from 120 up to 250. Where are you in there and more being discovered each and every day? That's why.
Totally. So I'm gonna put a caveat here that these numbers are not exact.
Yeah.
But I'll just share some kind of general knowledge here. So to clarify, what I said is there are hundreds of useful molecules in the plant. So there are, from recent presentations that I've seen with analytical experts who are actually doing the work to, in their own labs, validate how many cannabinoids can they identify. For example, Dedi Mary's lab at Technion in Israel does work like this. So last presentation I saw, they were at 130 cannabinoids. So, but then there's other things we need to consider. So there are terpenes. So I've seen numbers, I believe, for really high grade flower as high as traces of 30 or 40 terpenes in a single flower.
Wow.
So then we have other molecules, flavonoids, that are not terpenes, but still contribute to the flavor, some of these sensory inputs, and may have some other benefits down the line. Now, there's also a whole realm of other plant molecules. You think about any plant. Now, don't think about cannabis. Think about any plant out there. What are the molecules that make up, these plant families in general, and what are the potential physiological or medical benefits of those molecules? So that when we stack all these numbers on top of each other, that's why I'm saying there's hundreds of potentially useful molecules. The other thing that I should clarify, to get back to the cannabinoids, is that there are let's talk about one strain, one flower. So if you go to the dispensary and you purchase some flower, that singular strain that you have in your hand, maybe there's 10 or 12 or 15 cannabinoids in that thing that you have in your hand. I'm not saying there's going to be 140 cannabinoids in that one. Those 100 of that, or 130, 140 number is what has been identified in cannabis in general. Yeah, in the whole realm. So the other thing, kind of last comment I want to make there, is that as we were discussing earlier about safety and awareness of the kind of chemistry behind what is in your product, what is in your plant, is that you can often get this thing for these brands, and it's becoming more popular in regulated industries like in California, that you can request what's called a certificate of analysis, or a COA. And more brands are becoming conscious of making this available to the sellers, like the dispensary, so they can have it there ready for the customers. So what I want to highlight as a chemist is that, so in your COA, it may show that there's, let's say there's 5 cannabinoids or 10 cannabinoids, and there's 5 terpenes. Let's just say, for example, 10 cannabinoids, 5 terpenes. Now, that doesn't mean those are the only things in there. That means a few things. One, those are the ones a state probably tells the labs they have to test for. Those are the ones that the lab has the standards for and has the ability to test for. And then also, those are the ones that are within the range of detection of that lab's instruments. So for example, if your certificate of analysis says there's 10 cannabinoids, there could be 20 cannabinoids, and 10 of them you're never going to see, because the lab is doing this as a business. They're doing this as a regulatory measure. They're not doing it as like a scientific experiment to identify every minutia of every molecular component in that flower. So just as a chemist, I feel the need to kind of clarify my statements there.
So with you being a chemist, do you have that type of machinery where you can go in there and not just stop on the 10 if there are 20 or 30 other cannabinoids in there. I mean, they all have a benefit, and that's the thing that. Well, yes. Well, let me get you. So, because I've worked with scientists down at University of California, Santa Cruz, and he would go in there and make his own medicine. He would test it in his lab, and he would take it to another lab, and it would be completely off. And he's like, "Wait, I know it because I grew it. I tested in our lab, and why are your results different?" Back in the day where THC was the king and everybody wanted the highest ratios of THC, these labs would come back and they would say, give him high numbers. And he was like, listen, I don't need the high numbers. I just need to know what's in it for me to put it on the market, to have that, third party testing. They're not going to trust the lab here at the University of California, Santa Cruz. Before I move away from THC, because a lot of people come to us and say, I want the medical portion of the cannabis plant. I don't want the recreational portion. And so all these cannabinoids have their benefits. Your terpenes have their benefits, even the flavonoids. And so THC, as it's been proven to kill cancer cells, it's, minute amounts will help. It's like having, if you're going to go do a wine tasting, you can have a sip of wine, or you can drink 3 bottles of wine. 3 bottles of wine, you're probably going to be completely loaded. A sip of wine, you're not. And the same thing with cannabis, bringing it into the entourage effect, while they all have their purpose in there. Can you you being a chemist, talk about the benefits of the flavonoids, terpenes, and the cannabinoids being brought together, and how that entourage effect works and why it's so important for our bodies?
Sure, absolutely. And you were saying something interesting about the testing earlier, so if you want, let's come back to that, but let me answer your direct question now. So yeah, the entourage effect is really important, and I like how you brought that up. It's interesting. It's just an interesting comment, and I think it shows some naivety on the for some consumers, and we're all naive about different things, so that's meant with no offense, but when you say the medical versus the recreational, it's almost humorous, because it's just one plant, and it's really about how you use it, the amounts you use it, the products you're using that define that. So anyways, but to speak to the entourage effect, yes, I'm happy to. So the basis, the most simplistic way I can express it is that any one cannabinoid or terpene that you could isolate from the cannabis plant is likely going to be less useful for a medical purpose than a combination of these things. So for example, if someone is just to take straight THC, or here's an example that we can take. This is a great one. So a lot of people are familiar with Epidiolex, which is the first FDA-approved cannabis-based drug. Now, and that's created by this company, GW Pharma. Exactly. I was spacing for a sec. So now, what some people don't know is that GW had a drug years ago before that called Sativex that was on the market for a long time. I forget if it's 15 or 20 years. It was on a long time. And a lot of people thought, okay, this is going to be the revolution. We're going to have, cannabis-based medicine on the market. But Sativex was essentially pure THC. And you know what? The patients didn't like it. The people that gave it to for cancer pain or for wasting syndrome due to cancer and things like that, it didn't really work for them. And the folks who had used cannabis before whole plant medicine, utilizing the entourage effect, especially knew the truth. So this is just a really valid example of when that single molecule, the THC, even when provided by a big pharma company, it wasn't helping people. So now you look at their new drug, Epidiolex, it is mostly CBD, large portion CBD, but there is a little bit of other cannabinoids. So to take us back to the entourage effect, so at the very baseline, let's add 2 cannabinoids. So not just THC, but THC and CBD. And then if we're going to go into, you can begin to add others all the way up to when you get back to the full plant. So I explained it in one way, starting with THC and building back up. but I want to represent it in another way. So I'm a big believer in whole plant medicine. It's interesting how nature and evolution works, that there's a reason that these things have evolved and exist in the form they're in. So we take the cannabis flower, and as we mentioned, a high quality flower will have a large amount of cannabinoids, a large amount of terpenes, a large amount of flavonoids already in that flower. So that is the broadest, most full-blown entourage effect you're going to get. Now, different flowers will have different chemical blends, and for folks who don't like to smoke, there's a lot of other options. You can do a simple extraction at home with olive oil or with butter and things like that. So there's a lot of options for folks to get these molecules into their bodies. But then as we go down from there, there is, in the industry, people who do extraction to make kind of refined products, such as, Rick Simpson oil or other things like that. So through every step in refinement, you're kind of losing a part of the entourage effect, all the way down to where you get to where GW was with Sativex, where you have just THC. So I hope that answers your questions.
Yeah. And with that Sativex, maybe that was their beginning, because I think now, not trying to put you on the spot or correct you, I think they are a 2.75 of THC, milligram THC, and a 2.75 milligram of CBD. And their company's been around, and I don't think they made any money on their Sativex product, because people have replicated it, a 1-to-1 ratio, is what people are doing. And it wasn't available here in the US. Now Epidiolex, I think they got creative and worked with our government here. And, the story goes that the U.S. government lent or leased the patent over to GW Pharmaceutical, and they came out with Epidiolex, changed the scheduling for that. Now this is not where I was going to go with this conversation anyway. Sorry, man. But
no worries.
Chemist. But now Sativex, Epidiolex, bringing the stigma down, because now your doctors are talking about it, your neurologists are talking about it, your pharmacists are talking about it. It's accepted in pharmacies now, and it's insurance covers it. I have a dear friend, her daughter is on it right now, and at first I was like, not going to work. It works, and they've been using cannabis for the last 3-4 years and she's an autistic, functioning autism female at 20 with epilepsy as well. And actually, Nigam, it's working. And so and I've seen it, and it's cheaper because insurance is covering it. But at first I was like, don't do it. And seeing with my own eyes that it is working, I'd love to get Epidiolex on the show to explain this, because a lot of people are pushed away, but it's not available for everybody. Cannabis is not available for everybody, one, but also two, it's expensive, and if you're going through that much product in a day, for some people have to take high doses of CBD and again, I didn't want to go down the whole Epidiolex topic. Do you know if it's available in all 50 states, or is it only available in legal states? I don't even know. I have to research that.
Yeah, I'm not. I don't want to speak to that firmly, but because it is FDA, because it is FDA approved, I would hope it is. Yeah. Also, just to confirm what you were saying, I just did a quick search while we were sitting here talking, that you're correct about Sativex. Now it is a 1-to-1 ratio. So just to clarify for the listeners, I think that either the formulation was changed from when it first came out, or maybe it wasn't Sativex that I was referencing, but there was a different drug prior. But the point of my story holds true from before, that pure THC was tried before in one form or another for patients, and it didn't work, is the point. So, but I see that Sativex currently as a formula you're correct, does have that 1-to-1 ratio, and that's great to hear that you know folks who it's working for. And I actually and I'm sorry, what was your direct question following that?
I don't even know, but I was thinking maybe it was Marinol, that was a THC pill.
Oh, I'm sorry. That's exactly what it was. I said Sativex, but I meant to say Marinol. That's
Gotcha.
exactly what it was.
So,
yeah, thank you for saying that.
And I actually, I know a lot of doctors in this industry that are in illegal states that can recommend, and they do that for some of their pain patients. And just as they can get some cannabinoids in their system here too. So another conversation on the pharmaceutical side of this industry when it comes, with big pharma getting involved with there too. What do you recommend for cannabis naive patients? That first time they're, again, trial and error. Either they live in an illegal state or they don't want to, or they're afraid to ask the question to their family members or doctors, and they go down there and try it themselves. It's not a one size fits all. I share this all the time. Not a one size fits all. It's, you have to look at age, the weight, the current health condition, as you mentioned earlier, the patient, any other medications that they're on, and sensitivities, and it's not just a one size fits all, as I mentioned. Can you talk about what you would recommend for cannabis naive patients?
Definitely. So, and I think you did a great job of summarizing the complexities. So the first thing, and this is just something that everyone says, Ethan Rousseau says it, our mutual friend Beth Dose says it, that start low, go slow. So that's good baseline. If you forget everything I said after this, start low, go slow. So other things that are...
Do you know that's in Sativex's instruction manual when you get their...
Is it?
Yeah. So even the pharmaceutical companies are saying, okay, let's go. I don't know if they direct it as that is start low, go slow, but it says start low, see how your body reacts, and go that way. And I mean, I worked with a lot of pharmacists, and they're just, I showed them right there, and they said, I'll be darned, So anyway.
That's funny. I guess I wonder if that's Dr. Rousseau's lasting influence, because I know that's a big mantra of his, and then he was with GW before, so maybe that's maybe he's his legacy continues. So, but anyways, so other kind of useful inputs for beginning users or naive users. One is that we often hear this thing about THC being an intoxicant, CBD not being an intoxicant. I don't love that black and white delineation, but what I would say is that it's good to start with products that contain CBD, because here's what happens is that the CBD actually on a receptor level is competing with the THC. So if you consume both at the same time, it's actually going to let you get some of the benefits of that THC and the therapeutic benefit, and even some of this, what our society calls the high, but the CBD helps kind of keep it at a more moderate level. So for a first-time user, trialing something that is has CBD in it, be it a 1-to-1 ratio or something, I think that's good. The other thing that I can recommend is to just, for example, if you're going to use something like a smokable or a vapable product, to don't go overboard. It goes back to start low and go slow. Take one hit, wait. If you're smoking or vaping, wait 10, 15 minutes. And here's the thing. We've got a lot, there's a lot of time. There's always more. So there's no rush. On the flip, and then when you're talking about edible products, there's always a good option to take smaller doses. So especially if you're in a recreational market and you're buying a pack of gummies or a chocolate bar or something, to take one piece or even half a piece. There's no shame in cutting a gummy bear in half, these kind of things. The other thing that I want to say is that, cannabis it's been prevalent in our society, and it's really permeating more and more with legality in the recent years. So I would say don't be shy to reach out to folks or to seek resources. I know United Patients Group has a lot of resources for people on this topic, and there's other resources as well. So, it is unfortunate when stigma inhibits people and inhibits their ability to talk with their families and stuff like that. But I would say there's always somebody. So everyone has a a colleague or a coworker or a friend or a family member, somebody who has an understanding of cannabis. So I guess what I would say is there's no reason to go at it alone. There's seek support, even if it's not on your personal network, from a group that knows how to assist patients like yours. So
It's funny. I remember when you and I spoke a few weeks ago, we were talking about that. And I think the best type of education is almost like the ripple effect, like throwing the pebble in the pond and the ripples go that way, but getting it out there. Someone listening to our show here, they can share it with their family member who shares it with their doctor, et cetera, et cetera. I've had phone calls from buddies from high school saying, thank you. And I said, what? It's like, my mom spoke with you. Or my mom spoke. I mean, you know who the biggest advocate? My mom, who is, if my dad didn't marry her, I guarantee you she was going to be a nun. So,
wow.
But she's been the biggest advocate. But sometimes it takes someone that's out of your circle, that's out of your true family, your little family circle, to open the door and say, it's like, well, I've been trying to tell you this for years, Mom, but you haven't listened. And so I think the education is important for consumers. Understanding products, as you're talking about, Nigam, is, look for the test results. If you're in a legal state, it's almost common sense, but if you're in a legal state, and you purchase your product, your medicine at a dispensary, and if they don't have, all companies now should have a barcode, a QR code, or a recent test results. When I say recent test results, I'm a fan of more about 4 months old. I wouldn't look at something and try something that has a year or a year and a half old test results. And so make sure they have test results. If they don't have it in their dispensary, try another product, because I guarantee there's a bunch of them out there. If they don't, call the actual company yourself. They should nowadays, with regulations as you were talking about, all products, and I don't know if that's available in all states, but in the majority of states, that are even coming on are stricter than we are here in California. I mean, because back in the day, there were no regulations. I mean, if you had test results for a product, that was a rarity. Now, now it's almost it is mandatory. With you, I guess, Via Innovations, are you coming up with new products? Do you want to talk about that, or is it not yet for the public?
No, yeah, I'm happy to touch on it briefly. So I work with a cannabis product formulation company called Via Innovations. So we're working on some exciting things. We formulate in a few different areas, one of which is oral dosing. So basically fast dissolving tablets. So that's pretty cool. If you think about taking a kind of traditional cannabis edible where you would take a cookie or a brownie, and it may take 90 minutes or 2 hours to work, and the dosing is inconsistent and stuff like that, versus taking a pharmaceutical grade tablet that melts under your tongue in a few seconds, gives you an exact dose, is formulated in a way that it works quickly, and you know exactly what you're getting. And there's different ones that mimic the different effects you could get from an indica hybrid or sativa plant. I know that those terms are falling out of favor in the industry, but yet here we are still using them. So anyways, that's one thing. Via Innovations also is working on topicals. So we have some really interesting IP on topical formulations. For example, sunscreen. So that's something to keep an eye out for in the future, is sunscreen that's enhanced with cannabinoids. We've actually done research to show that cannabinoids can enhance the protection of sunscreen. So that's really great. And then aside from sunscreen, there's other benefits. For example, I'm sure a lot of folks are familiar with these kind of muscle rubs or other topical treatments for joint pain or muscle pain or dermatitis and stuff like that. So we're working in that realm as well. So those are some of the things I can share for now, and I definitely would encourage folks to keep an eye out for Via Innovations technology in the future. And yeah, definitely check out our site and feel free to reach out to us there if you have any interest in pharmaceutical grade cannabis formulations.
It's funny you talk about, all the different uses of cannabis, and a lot of times when I present, I'll put up on the screen in one of my slides is a big roll of duct tape, and the audience looks at me like, "Hey, you had the wrong slide up there." And I said, "This duct tape, people always ask me, does it work for this? Does it work for that? Is it useful for sunburns?" And I always say, you know what? I don't want to say cannabis is like duct tape with 1,000,001 uses, but when you really get down to it, I mean, I know patients that use it on CBD on bug bites as well as on sunburns. So you coming up with a product with sunscreen, I think is fantastic. Before we get away, you've spoken about the edibles, and we're talking about cannabis naive patients. Smoking and vaping, you said take one little drag just to see where your body reacts and how it reacts. It's not for everybody. Edibles sometimes take half hour up to an hour and a half, 90 minutes before you feel anything. And so just because it looks tiny and small, it's totally safe. Be careful, because sometimes you don't feel it. And this happens a lot with a lot of seniors that we work with. It's a delicious cookie. They eat it. They say, "God, I want another cookie. I'm not feeling anything." And next thing you know, they think they're having a heart attack and they're going to the hospital. A lot of ER doctors that we work with say one of the number one things for seniors that come in here, and actually just cannabis naive patients, is they think they're having a heart attack when it's actually they just received a double dose of cannabinoids, sometimes a little more uncomfortable than they're expecting. And cannabis, once eaten, it's not like alcohol. You drink too much and you throw up and go, "Ooh, okay, I feel better now already. I won't be doing that again." Edibles will stay in your system, and it's not life and death, but it could be uncomfortable. If that ever happens, sleep it off. Take a warm shower if you're able to do it. Dr. Bierman, who we've had on the show numerous times, talks about chewing on pepper kernels, or I call it the anti-venom, is have a CBD vaporizer pen that you can have. And it's amazing. I know you take some more. Most patients are like, "Are you nuts, Nigam? I'm going to take some more." But I've seen it, and can you share that before we part ways here, and why and how that balances out that the overabundance of THC in the system?
Sure. Yeah. Let me respond to that directly, and then I want to come back to something about via innovations. So, yeah, you make a good point. I was actually thinking that Dr. Behrman's input, I've heard that as well. Haven't tried it personally, but I've heard experts say that, and I don't doubt it. And you're correct. I was going to say the same thing, that it's funny. Usually you're right. It's bad advice to say, "Oh, you're having trouble, take more." But to clarify, if you're having trouble with THC, we're not saying take more THC. We're saying take CBD. And then, as I had referenced earlier, that on a molecular level, what's happening, so these molecules are binding to receptors in our system, which are giving us these cognitive effects. So what happens on a molecular level is the CBD is outcompeting the THC for space on those receptors. So what you're doing basically is you're replacing the high, you're replacing the effect. So if you're having too much of a high and an over effect from THC, you're exactly right. What you can do is you can use a CBD vaporizer, or like a fast-acting CBD edible or something, which I'll speak to in a moment from Via Innovations, to do exactly what you said, to calm down that high. So I wanted to reference something else, and this is kind of an interesting thing, and what I think is a legacy thing, and it's kind of interesting. It's a legacy thing. In this moment, it's a recreational thing. But because we have this issue with, patients' rights and right to access of cannabis, we have this whole blend of medical and recreational and home grow and all these things. California is a leader now, but how did we get this leadership status? We started 20 plus years ago saying, let's call it medical and get it moving. And then the people who cared got under that umbrella, and so on and so forth, right? But anyways, back to talk about these products. What I'm saying about the legacy is that it's kind of interesting. I don't want to say silly, but maybe it's a little bit silly that you take a person who needs medicine. Like, let's say you take a person who needed to take an aspirin for their heart, or to take a ibuprofen for muscle pain. You wouldn't put ibuprofen in a brownie and say, "Here, patient, eat 1/16 of this brownie and tell me how you feel in 90 minutes." You give them a safe, GMP, pharmaceutically formulated pill with an exact dose, and they know exactly how it works, and it's been studied and verified by experienced pharmaceutical companies and by medical doctors. So that's exactly what Via Innovations does. So when I was referencing earlier some of these tablet products that we kind of focus on and own the IP for, is that that's exactly what it is. Because you think about someone who, like an older person who maybe has pain or has other issues, or sleep and these kind of things, and they want to try cannabis. Why are we giving, or why is it that the option for this person is gummy bears or a cookie? If they can have a tablet that's just like their aspirin, and it works medically, and it's exact dosing, and it works not in 30 to 90 minutes, but maybe in 30 to 45 minutes. It works faster, right? So you can understand and you can dose more appropriately. So I think this evolution from kind of the legacy and some of these kind of mixed things between the rec and the med and the right to access and all that, and moving towards kind of solidifying the function as a medicine that kind of aligns with how we understand medicine in other realms. I think that makes sense, and I think that's good for the consumer to be able to use cannabis as medicine while avoiding some of these potentially negative effects that we hear these stories about.
Well, it sounds like you guys are I should say the future looks bright for the cannabis patients, of what's around the corner, and Via Innovations. And so is this a working company right now where products are available, or are you still at the startup stage?
Yeah, great question. So Via Innovations was started about 3 years ago by the founder and my colleague, Dr. Monica Villalpando. So it started as a consultancy and now has grown into an IP and technology company focused on this space. So what we're working on right now is continuing to build and solidify our IP portfolio, and we're working with partners and assessing options for bringing this technology to consumers in legal jurisdictions. So unfortunately, I can't point the listeners right now to the product, but John, I've so much enjoyed getting to know you and appreciate your invite to be on your show. And what I'll make sure to do when we're moving closer to that in the coming months, to drop you a line, and maybe what we could do is have a refresher and give people an idea of kind of what we're working on and where they can kind of find this technology.
I'd love to have you on. Again, I've enjoyed you being on the show, Dr. Nigam Arora. And well, I was going to say the whole list, but I'll say with Via Innovations, we'll get you back on the show and you can share more about what you're doing and what you've developed for the consumer, safety and accurate dosing formulations for the patient. So any closing words? Are you good right now?
Oh, yeah, I'd just like to say thanks, and to the listeners, if they're seeking more information, there is the American Chemical Society, which John mentioned in the beginning. I work with. They have a cannabis chemistry subdivision, which focuses on bringing professionals in the space forward to discuss research and give them a platform to present the research and disseminate valid knowledge in the space. So that's a good resource. And other than that, of course, United Patients Group. So yeah, that's kind of what I'd like to close with, and hope to see you soon. Thanks a lot, John.
Thank you very much, Dr. Nigam Arora. We'll get you back on the show, and thanks for your time as well and sharing your expertise and knowledge of this wonderful plant. Everyone, this is John Malanca with the United Patients Group. Be informed and be well. We'll see you soon. Bye-bye.